Hi, everyone. Welcome to the LactFact podcast, which highlights recent clinically relevant research, policy statements, and protocols that you, as a practicing lactation professional, would probably like to know about. I'm your host, Dr. Eglash. I'm a board-certified family physician and breastfeeding and lactation medicine specialist at the University of Wisconsin School of Medicine and Public Health. This podcast is written and produced by the nonprofit organization IABLE, which is the Institute for the Advancement of Breastfeeding and Lactation Education. We have no commercial funders for this podcast series. Hi, everyone. Today I want to talk about a recent study that came up on PubMed but has not been peer-reviewed yet, called Leftover Infant Milk After Bottle Feeding, Parental Practices, and Microbiologic Findings. The first author is Anna Zaishlinsky-Scharf, and she and her colleagues are in Germany. The primary question in this study is to find out how long it's safe to offer milk from a leftover bottle to an infant. What I mean by a leftover bottle is a bottle that has been in the baby's mouth and the baby has not taken all the milk. At this point, the United States Centers for Disease Control recommends finishing leftover bottles within a few hours. The problem is that there have been no major published studies on this. The authors of this manuscript did two studies. First, they did a survey of 1,056 mothers to gauge their experiences in feeding leftover bottles. Then they looked at bacterial growth in bottles fed from 44 infants. For the online survey, they gathered typical demographic data, and they asked questions about how often they discard bottles of milk and how long after initially feeding do they re-offer the same bottle to their infants based on whether the bottle was sitting at room temperature versus the refrigerator. Among the survey respondents, 46% reported discarding bottles of leftover milk at least once a day, and this could have been either human milk or formula. About 67% of those who discarded milk chose to do it immediately after the feeding. About 12% would offer leftover milk if it was refrigerated, and only 7% would offer leftover milk after more than 2 hours at room temperature. The second part of the study involved recruiting 44 bottle-fed infants so they could take a look at cultures before and after feeding from a bottle. So 21 infants drank formula from bottles and 17 infants drank pumped breast milk from bottles. The parents who fed formula were advised to mix the formula as instructed by the manufacturer, which included using hot water, which is important because hot water will kill bacteria. In this study, the parents who fed express breast milk were instructed to use milk that was pumped within the last 24 hours or milk that was defrosted within 2 hours prior to feeding. So they swabbed the bottles of either formula or human milk right before the feeding to run a culture for baseline bacterial growth. And then they took another swab from the same bottles after the infant feeding to check on the difference in bacterial growth. So they found that for breast milk, before the feeding, the average bacterial culture was about 4,200 colony-forming units per ml, which is considered kind of low. And the normal range for bacterial growth from breast milk can be anywhere from 300 to 350,000 colony-forming units per ml. After the infant was done feeding, the bacterial count increased to 24,600 colony-forming units, which is still within that normal range. They then incubated the formula or breast milk at either 4 degrees Celsius, which would be refrigerator temp, or 20 degrees Celsius, which would be room temperature. And they found that the average bacterial burden in both the pre and the post-feeding samples of human milk were stable after 8 hours at either room temperature or refrigerator temperature. The bacterial counts in the pre-feeding human milk sample remained within baseline ranges, while the post-feeding human milk samples at both room temperature and refrigeration increased, but it was not statistically significant. The incubated formula samples also did not have a very significant increase in the amount of bacterial growth after feeding, even after 8 hours of storage in the refrigerator or at room temperature. They didn't see a significant increase in bacterial burden until they stored the post-feeding formula sample for 24 hours at room temperature. They then looked at the type of bacteria that was growing in the milk after feeding, and they took swabs from the baby's mouth to check the bacterial composition. They found that the bacterial samples in the post-feeding breast milk bottle was similar to the pre-feeding sample. So there wasn't a huge amount of growth of infant oral bacteria. In the formula samples, the post-feed bacterial species looked a lot more like the infant's own oral flora. So in looking at those findings, they decided to see if there's any other work that they could compare it to. And they found two small studies. One was an undergraduate thesis with 6 infants that looked at bacterial growth in leftover human milk. And they found a pretty similar range of bacteria, like not a huge excessive growth. And a second study was a dissertation from Japan with 11 infant mother pairs, where they incubated post-feeding human milk samples for 3 hours and 12 hours in the refrigerator, with no significant difference in bacterial growth between the pre- and post-feeding milk. So the authors of the study concluded that it would be safe to suggest allowing babies to have leftover milk up to 4 hours after the initial feeding. This suggestion is probably based on the limitation of their study, which is that it's possible the subjects were careful with the cleanliness of their bottles that they were using, because they knew that if they were going to be in this study, they obviously would really not want to have their milk appear to have tons of bacteria, because that may have, that may reflect upon them, right, in terms of their cleanliness. I think it makes practical sense for babies to have a leftover bottle of breast milk or formula since the last feeding, since babies feed pretty often. Breast milk has lots of white cells and other antibacterial factors that'll keep the bacterial counts from overgrowing in the first several hours after feeding from the bottle. I was surprised, though, at the lack of significant bacterial growth in formula. That said, most of the parents did use hot water to prepare formula, which could kill the baseline bacteria. The problem is that most people don't do that in real life. So I would not generalize this finding to add to when advising parents about leftover feeding. In other words, I would probably still limit it to 3 to 4 hours after 3 or 4 hours to use a leftover bottle of formula. Breast milk, as compared to formula, is likely safer longer at room temperature and in the refrigerator because of its antibacterial properties. And finally, are there any other changes in expressed breast milk that we should consider on this topic? So one of the assumptions in the study is that bacterial growth is the only marker of safety of human milk. The bacterial growth based on this research does not appear to be a problem, but what about the changes in antioxidant levels, which are probably decreased, as well as the breakdown of triglycerides leading to free fatty acids? The free fatty acids will change the pH of the milk, which it's unclear if that makes a difference. But we also know that there's oxidation of the free fatty acids and then eventually an off odor. But in reality, after 3 or 4 hours, it's probably not a major problem, and breast milk is still going to be nutritionally superior to formula. So it would be better to feed leftover breast milk that has been left at room temperature or in the refrigerator for 3 or 4 hours and possibly longer, as opposed to tossing that milk and giving formula instead. Hey everyone, thanks for listening. I encourage you to check out iAble at lacted.org, which is LACTED.org, to learn more about our educational projects, courses, educational handouts, videos, live conferences, and webinars. By becoming a member, you are not only supporting our free projects, but you will also receive a series of benefits which you can learn about at our website. I'll be back with another LactFact in a few weeks.